Hi, I'm Stephanie Prodick, and this is my COVID tracking data. So the data I compared was of South Dakota and Virginia, starting from August 24th to September 30th. Starting off with the new cases for South Dakota were significantly lower than that of Virginia. That being said, however, we had the higher positivity percentage than Virginia. So, kind of looking at the new cases, South Dakota had a low of 66 on August 26th, which I believe was a Sunday, so there wasn't much recording going on that day. But for the beginning of September, it didn't really spike above 300. It did on roughly 4 different occasions for the beginning of September. But right after the 66 new cases were reported, it jumped into the 300s the next day. Then, looking down closer to the end of August and September, it picked back up pace, having a high of 579 on September 26th, with a total of 2,187 cases or tests being conducted. Then kind of looking back at that 66 at the beginning or at the end of August, the total tests conducted were at 86, which gave it a high positive percent at 76.44%. Then kind of looking at Virginia, it kind of varies, but not that highly. The lowest to drop down in this month of data was to 645 and a close one at 664. But otherwise, it kind of remained in the 900 range. As you can see, there are a few thousand, the highest being 2,134. Along with that day, 36,894 tests were conducted. So the reason that I can conclude that Virginia had the lower positive percentage was because they had significantly more tests being conducted. Looking at August 31st, we only had 878, whereas Virginia had 13,124, which is significantly higher. That's what they had, very close to what they had in positive tests to what we had conducted. Then all their data for Virginia, their positive percentage only once spiked above 10%, and that was on August 27th at 10.86%. Otherwise, it remained in either the 5% or lower, and closer to the end of September, it was even in the 2% range. Although on one day it does spike to 12.92%. So then looking at my sheet, first off, I'm going to lightly explain my sheet. I have a double y-axis sheet to kind of better explain the data because South Dakota had a way higher positive percentage that you could not really tell what Virginia's percentage was. Then that being said, Virginia is the blue line, and it is represented by this axis, seeing that it only goes from 0 to 14 for the percentage. Then South Dakota is represented by the green line and represented by this axis, since it goes from the 0 to 90% range. So then looking at the beginning of, or at the end of August, beginning of September, that is when both Virginia and South Dakota had their spikes in cases, or positive percentages, being that South Dakota had its high point of 76.74%, and Virginia had one of its two as high points at 10.86%. The next spike for Virginia is September 19th at the 12.92%. But in that time in between, Virginia is kind of in its stagnant, like about 7% range, and it doesn't really dip below that, sometimes going into the 5s, but besides that, it sticks within this area. After it hits its second peak at the highest point, it does drop down into the lower numbers and lower range, even going into the 2% range. Then looking at South Dakota, after it hits this high 76%, it drops down significantly within the next few days and remains kind of in the same 20 to 30%. Primarily being in the high teens, low 20s, and occasionally jumping up into the low to mid 30s. Here, the point I have selected for September 24th, the value is at 30%, which is at one of its higher points. And from the looks of it, it is continuing to increase into October. So we're hitting our peak, or looking like we are going to. Then moving to the New York Times, sorry about that, and the positive testing on October 19th. The states meeting the testing requirement were at 9, states near the target were at 6, and 36 states are below the target. On the below the target, both South Dakota and Virginia are included into that, so neither of us are doing the greatest. But looking down here, if it will scroll, South Dakota is at the top of this list, being that it is 12% below the testing target. So in terms of this, we are not doing so good, but Virginia, it is a little lower on this list, and it is at 62% on being at where it needs to be. So the higher states include Maryland, Rhode Island, New York, Washington, D.C., New Hampshire, Connecticut, Massachusetts, Vermont, and Maine. And this may be because they got to hit their peak a lot earlier in the COVID-19 season, or when it first came to the states, especially New York. It was hit very hard, and because of it, they had a lot of positive tests and quite a few deaths as well. So now it's actually able to kind of decrease and result from the peak. Whereas South Dakota, we have a lot lower population, and we don't get that much people in here. We're hitting our peak because we had Raleigh, which brought in people from all over the country, which caused us to kind of hit our peak and get COVID and grow in that sense. So our country as a whole, we are not hitting our targets. It does vary by region, but at the same time, you have to take into account what is the state's population, what is their healthcare look like, what even is their average income, because that also helps determine the healthcare effect. So state that is a little bit more wealthier will tend to have higher healthcare benefits for a majority of the people, since they have higher incomes, so that they are able to get better healthcare and be able to be treated for COVID more effectively, or be hospitalized and looked after, whereas states where we don't have high healthcare or and low incomes, these states are going to be at a lot higher risk for having more peaks and a lot more infections and possibly death. The testing in the United States influences my project because I chose South Dakota, which has a low population, versus Virginia, which has quite a higher population and is different location geographically. So there'd be more people interested in being there than they would here. So you get to see the higher end of the spectrum and the lower end of the spectrum on population, and just what states are doing more than a little state like South Dakota. Then this information directly influences public and healthcare for healthcare, because in public, people will tend to either follow the herd or just rebel against it, being that lots of people may not want to wear masks when they are out in public. For example, Black Hills State is at a level 3 mask policy where we only have to wear them inside in all public spaces. So outside we don't have to wear them, whereas most people may not want to do that in any public space in general either. So it just kind of creates this big divide on if people are wanting to pay attention to the healthcare or want to listen, I guess. I don't want to make them sound at all bad, but it just kind of shows who is more open-minded about trying to help others and themselves and everyone around them, or think that they may be more informed and such, or just not worried about the virus in general. Then this has kind of turned into a political campaign strategy because some people, like I said, they may not want to wear their masks, so they might go with the political member who says, let's ditch the mask, let's get through this together, and will encourage people to not be afraid of it, or they'll go with the political person who is taking this like it's the plague and is trying to encourage more health benefits or mask policies. Well, that is my report. Thank you so much, and I hope that you learned something from my data.